Prescription weight loss medications. 1. Orlistat, Xenical or Alli. Use: blocks absorption of about 25% of fat consumed in meals. How it works? Inhibits pancreatic lipase enzyme that breaks down fat. Note: available over the counter in lower doses, Alli, and prescription strength, Xenical. 2. Phentermine. Use: short-term appetite suppressant for obesity. How it works? Stimulates the central nervous system, reducing hunger. Note: typically prescribed for 12 weeks or less due to potential dependency. 3. Liraglutide Saxenda. Use: injectable medication for chronic weight management. How it works? GLP-1 receptor agonist that slows stomach emptying and reduces appetite. Note: originally developed for diabetes as Victoza. 4. Semaglutide, Wegovy. Use: weekly injectable for chronic weight management. How it works? GLP-1 receptor agonist, similar to liraglutide but longer acting. Note: shown significant weight loss results in clinical trials. 5. Phentermine-Topiramate, Qsymia. Use: combination drug for long-term weight management. How it works? Appetite suppression, phentermine, plus satiety increase, topiramate. Note: not suitable for pregnant women due to birth defect risks. 6. Naltrexone-Bupropion, Contrave. Use: combination medication for chronic weight management. How it works? Affects brain's reward system and appetite control centers. Note: may help with emotional eating and cravings. 7. Setmelanotide, Imcivree. Use: for rare genetic obesity disorders. How it works? Activates melanocortin-4 receptors involved in hunger and energy use. Note: very specific indication for genetic conditions. 8. Metformin, off-label use. Use: diabetes medication, sometimes prescribed for weight loss. How it works? Improves insulin sensitivity, may reduce appetite. Note: primary use is for type 2 diabetes. Weight loss is a secondary benefit. 9. Tirzepatide, Zepbound. Use: newer injectable for chronic weight management. How it works? Dual GIP/GLP-1 receptor agonist. Note: also marketed as Mounjaro for diabetes. 10. Topiramate, off-label use. Use: anti-seizure medication, sometimes used for weight loss. How it works? May reduce appetite and increase feelings of fullness. Note: primary use is for epilepsy and migraines. Warning: before considering any weight loss medication, medical evaluation required. These medications are prescription only and require proper medical assessment. Not for cosmetic weight loss, typically prescribed only for BMI greater than 30 or BMI greater than 27 with weight-related health conditions. Side effects exist. All medications have potential side effects ranging from mild to severe. Not magic pills. Medications work best when combined with diet, exercise, and lifestyle changes. Long-term commitment. Weight often returns when medication is stopped without lifestyle changes. Contraindications. Many have restrictions for pregnancy, heart conditions, or other health issues. Cost considerations. Many weight loss medications are expensive and may not be covered by insurance. Safer alternatives to consider first: dietary modifications with a registered dietitian, regular physical activity and exercise programs, behavioral therapy and counseling, sleep optimization, stress management, support groups, and accountability partners. Always consult your doctor or a weight loss specialist before starting any weight loss medication. Self-medication can be dangerous and ineffective.